Could your cat be living with chronic pain right now without you even knowing it? Most cat owners imagine that if a cat has arthritis, it would be obvious. They expect limping, crying out, or dramatic signs of discomfort. But cats are masters at hiding pain. In fact, one of the reasons arthritis is so commonly missed in cats is because they often don't show the signs people expect. Instead, they quietly change their behavior, adapt their routines, and gradually stop doing the things they once enjoyed. Many owners assume their cat is simply getting older. But sometimes, there's much more going on beneath the surface. If you love cats and want to understand them better, make sure you subscribe and turn on notifications because we post new cat behavior and care videos every week. Arthritis is one of the most common health problems affecting older cats. It develops when the smooth surfaces inside joints become damaged over time. Normally, joints move comfortably and efficiently, but when the protective structures within the joint begin to deteriorate, movement becomes painful. The result is inflammation, stiffness, and discomfort. The challenge is that cats rarely advertise this pain. Unlike dogs, cats are not usually taken for regular walks where changes in mobility become obvious. Many arthritic cats simply adjust their behavior to avoid movements that hurt. And because those changes often happen gradually, owners may not notice them at first. Think about your cat's favorite activities. Do they still jump onto the windowsill as often as they used to? Do they still race upstairs? Do they still climb onto furniture effortlessly? Or have you noticed subtle changes? Perhaps they hesitate before jumping. Maybe they choose lower resting places. Perhaps they use the stairs more slowly. These small differences can be some of the earliest signs of arthritis. One of the biggest clues is reduced mobility. A cat that once leapt effortlessly onto high surfaces may suddenly start looking for alternative routes. Some cats stop jumping altogether. Others still jump but do so less frequently. You may notice them pulling themselves up rather than springing naturally. Or perhaps they're more cautious coming down from furniture than they used to be. Many owners interpret this as normal aging. But aging itself isn't a disease. Pain is not something we should simply accept as inevitable. Another common sign is increased sleeping. Now, cats already spend a large part of the day resting. That's perfectly normal. The question is whether your cat's behavior has changed. Are they spending significantly more time asleep? Have they stopped exploring the garden? Do they spend less time playing? Have they become less interested in hunting or investigating their surroundings? Pain often reduces activity levels, not because cats become lazy, but because movement becomes uncomfortable. This is where arthritis can create a cycle. The less a cat moves, the less active they become. The less active they become, the more muscle strength they may lose. And reduced strength can make movement even harder. Grooming changes are another important clue. Healthy cats are usually meticulous groomers. They spend hours keeping their coats clean and tidy. But arthritis can make certain movements difficult. Imagine trying to reach the middle of your back when every stretch hurts. Many arthritic cats begin grooming less thoroughly. Their coats may appear scruffy, greasy, or matted in places they can no longer comfortably reach. Sometimes owners assume their cat is becoming less concerned about cleanliness. In reality, they may simply be struggling physically. Interestingly, some cats show the opposite behavior. Instead of grooming less, they overgroom certain areas. This can happen when they repeatedly lick painful joints or nearby regions in response to discomfort. Changes in claw condition can also provide valuable information. Cats naturally maintain their claws through activity and scratching. An arthritic cat may become less active and scratch less often. As a result, claws can become unusually long. In severe cases, they may even begin curling into the paw pads, creating additional pain and problems. Temperament changes are another warning sign many people overlook. Pain changes behavior. A cat that was once affectionate may become more withdrawn. A cat that enjoyed being stroked may suddenly seem grumpy when touched. Some cats become irritable around other pets. Others simply choose solitude more often. This doesn't mean they love you any less. It may mean they're uncomfortable. Imagine having aching joints every time someone picked you up or touched a sore area. Your behavior might change too. While age is one of the biggest risk factors for arthritis, it's not the only one. Some cats are predisposed due to inherited joint problems. Previous injuries can also increase the likelihood of arthritis developing later in life. Excess weight can make matters worse. Although obesity may not directly cause arthritis, carrying additional weight places greater strain on already painful joints. That's why maintaining a healthy body weight is one of the most important parts of long-term joint care. One reason arthritis often goes undiagnosed is that cats may behave differently at home than they do at the veterinary clinic. At home, you might notice your cat struggling to jump onto a chair. At the clinic, adrenaline and unfamiliar surroundings may temporarily mask some of those signs. This is why videos can be incredibly helpful. Recording your cat walking, climbing stairs, jumping, or getting into the litter tray can provide valuable information. Speaking of litter trays, arthritis can sometimes affect toileting behavior too. If climbing into the tray becomes uncomfortable, accidents may start happening outside the litter box. Many owners assume this is a behavioral problem. Sometimes it's actually a mobility problem. The cat wants to use the tray, but finds access difficult. This is one reason why low-sided litter trays are often recommended for cats with joint issues. The good news is that while arthritis cannot be cured, it can often be managed very effectively. Veterinary treatments can significantly improve comfort and quality of life. Pain relief options continue to improve, and many cats experience noticeable benefits once treatment begins. But medication is only part of the picture. Small changes around the home can make a remarkable difference, providing steps or ramps to favorite resting spots, using soft, supportive beds, keeping food, water, and litter trays easy to access, adding mats to slippery floors, helping with grooming when necessary. These simple adjustments can reduce strain on painful joints and help maintain independence. Many owners are surprised by how quickly their cats respond. Cats that seemed withdrawn may become more social. Cats that stopped playing may become more active. Cats that appeared to be slowing down due to age may reveal a very different personality once pain is better controlled. That's why recognizing the signs matters so much. Arthritis isn't simply a normal part of getting old that should be ignored. It's a medical condition that deserves attention. And because cats are so skilled at hiding discomfort, owners often play the most important role in spotting the early warning signs. The next time you watch your cat move around the house, look closely. Notice how they jump, how they climb, how they groom, how they rest. Small changes may be telling a much bigger story, and catching that story early could help your cat stay comfortable, active, and happy for years to come. If you found this video helpful, please subscribe for more cat behavior advice, cat care tips, and expert guidance to help your cat live a happier and healthier life.